Zimbabwe recorded 61 suspected cholera cases in the last 24 hours amid calls by health experts to tighten control measures. This also comes in the wake of a rapid spread of cases in Harare, with areas like Waterfalls, Kuadzana and Dzivarasekwa reporting incidences. Initially, cases were recorded in Glenview and Budiriro, and according to the latest report from the Ministry of Health and Childcare, hospitalized cases jumped from 75 to 86 in the last 24 hours, with Chimanimani in Manicaland province reporting the highest number. The government says it is already preparing its hospitals to handle cases should they escalate. And we are now joined by the Harare Institute of Public Health Principal, Dr. Amos Marume, to get more on this subject. Good evening, Doc. Given that the country is still recovering from the impact of COVID-19, can the country's public health system stand further strain, do you think?
More is needed around the awareness and advocacy and health education, because we are coming from another pandemic. So, complacency is common. People are fatigued. They are tired of this, public health scares. So it means there is need for much work to ensure that people are alert and vigilant in terms of preventing further spread of cholera and other diarrheal diseases. So more needs to be done around there.
Now, Doc, what measures do you think the country should take at this stage to effectively manage the outbreak?
If we could, pull together more resources, whether from private sources, from developmental partners, and be ready to set up many, even those mobile facilities for especially in hotspots, that would be good. But also the underlying problem in most of our urban centers is just access to water, clean water. That's our primary problem with these diarrheal diseases. There is a need for proper, planning, discussions and debate around how we can ensure that we have a lasting solution, on issues to do with access to clean water.
Now, finally, Doc, with regards to the cholera vaccine, how effective do you think it will be in containing the outbreak?
Then for the vaccine, it works generally to prevent further spread during an outbreak. It works if it is widely available. It will be useful as part of many tools to use. But also, people need other, the whole range of options. The vaccine, the oral rehydration salts, those disinfectants that we were using that at the time in 2008 to sterilize water. They can also be distributed widely. So it's a whole lot of these issues: public education, treatment options, water purification tablets, those and rehydration salts, and also the mobile clinics that I talked about, such that people have access to healthcare facility much easier.
Thank you so much for that. That was, of course, Dr. Amos Marume, who is the principal of the Harare Institute of Public Health, giving us what he feels we could do to protect ourselves and our loved ones from the cholera outbreak that has seen an increase of numbers and cases in the last 24 countries.